To come in. I think I'll go ahead and get started. Welcome, everybody. My name is Dr. Beverly Gore, and I want to welcome you to the Region 6 Asian American Pacific Islander Health Summit. We are so pleased that you joined us here today. The theme for the summit is AAPIs in mental health, acute problems in need of timely solutions. I want to thank the sponsors and the Summit Planning Committee and the Hope Clinic staff who have coordinated this meeting. Mental health is a very important topic for us to address. We have all heard about the stigma associated with seeking mental health services, and although the stigma exists for all communities, it runs particularly strong in the AAPI community. There's a strong cultural value towards saving face, avoiding exposing weaknesses or sharing negative thoughts to the point that many suffer in silence. The goal of this year's summit is to begin the discussion about mental health in the AAPI community and to unwrap some of the stigma that surrounds it, to safely relieve some of the tensions under the surface. We hope you come away with new knowledge, new friends, and new tools to help us in reaching that goal. Between today and tomorrow's sessions, you will have the opportunity to hear from almost 40 outstanding speakers on various aspects of mental health. The program planners have prepared 4 different tracks in concurrent breakout sessions to allow for discussions on the mental health concerns for youth, older adults, the family and domestic issues, and the community in general. And now I have the privilege of introducing some of our very important guests and allowing them a few moments to make remarks. First, I wanted to recognize Dr. Andrea Karakostas, the CEO of the Asian American Health Coalition of the Hope Clinic. She regrets that she cannot be with us today, but recorded this greeting that you'll see on the screen.
Welcome to the 2024 Asian American Pacific Islander Health Summit. And for those attending in person, welcome to our beautiful new building. I am so very sorry not to be there in person with you, but you are in the best hands, and I'm sure you will enjoy every session. It's been almost a year since we opened the new Hope Clinic building, and the positive impact it has had on our staff and community is evident. There's a profound sense of dignity in our team and those we serve. I hope we can continue spreading our work throughout Houston and changing the concept of healthcare. This new clinic has the capacity to serve over 20,000 patients. It provides pediatric, OBGYN, family medicine, psychiatric, behavioral health, dental, and vision services, as well as having a pharmacy, a cafe, a prayer room, and a lactation suite for our staff and our patients. This new building is an example of how dreams do come true. It also reflects the aspirations of many of our patients that come through our doors. People like me, new immigrants that come to this country in search for a better life. What a privilege to be part of their journey to a brighter future. Personally, Hope Clinic has been a life adventure. It has allowed me to grow as a human being and has given me a platform to realize my dreams of providing world-class care regardless to creed, color, or social status. Today, we talk about equity and inclusion, but look around you. This is how equity and inclusion looks like. The Asian community is the perfect example of how collaboration across ethnic and cultural groups has allowed this very diverse group to flourish. For the next 2 days, you will be able to hear experts talk about their experiences working with the Asian American Pacific Islander communities, their challenges, and the many opportunities we have to better improve the health of this community. Lastly, I want to thank Dr. Beverly Gore for not only being the organizer of this event, but being the voice that makes sure Hope Clinic always keeps the Asian American Pacific Islander community up front and center. Also, a big shout out to my partner in crime and colleague, Shane Chen, and her team that made this summit possible. Enjoy the sessions, and thank you for being here.
Thank you very much. We have one other recorded greeting, and it is from Ms. Crystal Kai, who is the Executive Director of the White House Initiative on Asian Americans, Native Hawaiians, and Pacific Islanders.
Welcome to the 2024
Uh-oh.
Hello, everyone. My name is Crystal Ka'ai, and I serve as the Executive Director of the White House Initiative and the President's Advisory Commission on Asian Americans, Native Hawaiians, and Pacific Islanders. I apologize that my schedule did not allow me to be there in person with you for today's Region 6 Asian American and Pacific Islander Health Summit. But I want to thank Dr. Andrea Karakostas, Dr. Beverly Gore, and the Asian American Health Coalition of Greater Houston for the honor to join you virtually from Washington, D.C. Our White House Initiative and President's Advisory Commission were reestablished and reinvigorated by President Biden in May of 2021, and we are co-chaired by two members of the President's Cabinet, Health and Human Services Secretary Javier Becerra and U.S. Trade Representative Ambassador Catherine Tai. Under the Biden-Harris administration, the White House Initiative is charged with driving a whole-of-government agenda to advance equity, justice, and opportunity for Asian American, Native Hawaiian, and Pacific Islander communities all across the country. Our top priorities include addressing the horrific rise in anti-Asian hate that was exacerbated throughout the pandemic, tackling health, economic, and educational disparities, and ensuring our diverse communities have access to culturally and linguistically appropriate services and care. We know that AA and NHPI communities have been deeply impacted by the nation's mental health crisis in wake of the COVID-19 pandemic. And that's why I'm so thrilled that today's summit is focused on addressing the mental health needs of our AA and NHPI communities. I'm so glad that several representatives from the regional HHS office are with you in person today, including HHS Acting Region 6 Administrator Julie Lothrop and SAMHSA Region 6 Administrator Christy Brooks. As Secretary Becerra has said, mental health is health, period. And that's why HHS has been working hard to change the way that mental health is viewed in this country by decreasing stigma and improving access to life-saving support, including culturally and linguistically appropriate mental health services. Under the Biden-Harris administration, HHS launched 988, the 3-digit suicide and crisis lifeline, where Americans can connect with trained counselors who will listen and offer real help in times of crisis. HHS also established the first ever AA and NHPI Behavioral Health Center of Excellence to serve as a resource to behavioral health care providers, community and faith-based organizations, research institutions, and federal entities. And just last summer, the White House Initiative hosted an AA and NHPI Mental Health Summit in Washington, D.C., where community leaders, physicians, and clinicians and policymakers were able to gather to discuss ways to expand access to quality, affordable mental health services. But we cannot do this work alone. So I want to thank each and every one of you for your leadership and commitment to addressing our nation's mental health crisis. The White House Initiative is dedicated to meaningfully collaborating with you and continuing to support the integral work that you do. And together, I am confident that we can pave a path towards greater equity, justice, and opportunity for all. So thank you again for inviting me to join you today, and enjoy the rest of your summit.
Thank you.
Hello, everyone. My name is Crystal Ka'ai, and I
Sorry. All right. We do have some live guests too, which I'm very honored that they could join us. So I'd like to introduce next Miss Julia Lothrop, who Crystal mentioned in her video, who is Acting Director for the Department of Health and Human Services Region 6. So Julia, you want to come forward?
Thank you so much, and good afternoon, everybody. I want to thank Dr. Karakostas and Dr. Gore for everything that you have done to organize today's event. It's an honor to be with you, and how exciting to be in this beautiful new building. Congratulations on that. You know, the Hope Center's trajectory of success from a 4-hour-a-month volunteer-run clinic in 2002 to a federally qualified health center in 2012 to 5 locations today is truly amazing and inspiring. It's a testimony to your remarkable compassion for Asian American community, and I thank you for your leadership and service. We were thrilled that last year HHS Secretary Becerra visited the Hope Clinic And so he got to witness firsthand the importance of your work. So thank you all. And I also want to just thank Beverly Gore for her leadership in organizing this very impressive event. And thank you also to the Asian American Health Coalition of Greater Houston for your vision and leadership. I want to introduce Christy Brooks, who is our fabulous Substance Abuse and Mental Health Services Regional Director, or better known as SAMHSA, if you would just stand up and wave. So Christy is a licensed professional counselor and a tribal member of the Choctaw Nation. She's a proven leader in the areas of mental health and substance use disorder programming, and she is a very strong advocate for the rights of under-resourced populations. So thank you for being here and for your contributions. As you heard from Crystal, the Biden-Harris administration is committed to Asian communities and finding solutions for mental and behavioral health. And we're fortunate that Crystal is actually housed in HHS, so we're thrilled about that. But you know, everything we do at HHS is through a lens of equity. One of the president's first actions was to sign executive orders directing all federal agencies to intentionally place equity at the center of our work. And as Crystal mentioned, at HHS, we strive to ensure that mental health is treated like any other health challenge. Our country is facing unprecedented mental health and substance use crises among people of all ages and backgrounds. And while the rates of depression and anxiety were rising before the pandemic, the grief, trauma, physical and social isolation that many people experienced during the pandemic exacerbated these issues. So that's why meetings like this are so important, to share best practices, discuss viable solutions, and form partnerships to address gaps in care. In his first State of the Union address, President Biden announced a national mental health strategy that includes strengthening system capacity, connecting people to care, and creating healthy environments. And at HHS, we've been working hard to support overdose prevention strategies, bolstering peer support services, and addressing trauma-informed care. So services at our 1,400 community health centers, like the Hope Clinic, are invaluable for providing accessible and affordable behavioral and mental health care. HHS has expanded certified community behavioral health clinics to ensure around-the-clock services for those in crisis. And we've expanded school-based mental health care. You know, students are 6 times more likely to access mental health services when they're offered at school. So that's why partnerships like the Hope Clinic and the Aldine Independent School District are so important. The 988 National Hotline has received more than 7.6 million calls, texts, and chats that provide much needed counseling and connect people to their community resources. We've expanded naloxone to reverse opioid overdose, and the FDA has approved Narcan and Revive, which are 2 naloxone brands for over-the-counter use. Also, addressing maternal health is also a top priority for HHS. The U.S. has the highest maternal mortality rate among high-income countries, and this inequity is especially pronounced when comparing patients from different racial and ethnic groups. So Asian women have a pregnancy-related mortality rate that's about 2 times higher than white women. 1/3 of maternal deaths occur between 1 week to a year after childbirth. So continuous insurance coverage during the prenatal and postpartum periods is critical. So we at HHS have been partnering with states to take advantage of the American Rescue Plan's option to provide 12 months postpartum coverage to pregnant individuals who are enrolled in Medicaid or CHIP. And this expanded coverage helps to ensure access to care, including behavioral health services. It helps individuals manage chronic conditions like hypertension and diabetes, and it can help improve health outcomes. So we're excited that on Wednesday, the Centers for Medicare and Medicaid Services approved the Medicaid and CHIP postpartum coverage extension state plan amendment for Texas. So that's really good news. And this approval marks 43 states, Washington, D.C., and the U.S. Virgin Islands that have extended postpartum Medicaid CHIP coverage to a full year. Texas mothers will be able to stay on Medicaid for a year after childbirth. Medicaid covers half of all births in Texas. So this approval goes into effect on March 1st. And under the Texas plan, anyone whose pregnancy ended in the months prior to March 1st, and if they lost their Medicaid coverage, they are eligible to re-enroll so that they maintain that coverage for 12 months after their pregnancy ended. The CDC estimates that more than 13% of U.S. women report postpartum depression symptoms in the 12 months after childbirth. And we know that women affected by substance use are at the highest risk for relapse in the postpartum period. So that's why health insurance coverage is so important. Last week, HHS announced a historic 20 million people that have enrolled for health insurance plans through the health insurance marketplace. And in Texas, more than 3.2 million people selected health insurance from the marketplace. All marketplace plans cover mental health and substance use services as essential health benefits. So we appreciate the local navigators like Light and Salt, Boat People SOS, Civic Heart Community Services for their great work to assist people with their enrollment choices. Also, I'll try to make this quick. The states and HHS continue to work diligently to make sure that people who have been continuously enrolled in Medicaid during the pandemic know to update their contact information with their state agency or insurance provider. So now that the COVID public health emergency is ended, states are redetermining eligibility for Medicaid and CHIP coverage. So we ask your support to disseminate information and to help to ensure that people maintain their health insurance coverage. And finally, I just wanted to mention HHS has been working hard to implement the President's Prescription Drug Law, or the Inflation Reduction Act, that will lower the cost of prescription drugs for people with Medicare. So the IRA, Inflation Reduction Act, is the biggest health reform initiative since the passage of the Affordable Care Act, which gave us the health insurance marketplace. And as a result, for people with Medicare, the price of their insulin is now $35 a month. Recommended adult preventive vaccines are free. And for the first time, Medicare will get to negotiate the price of medications. So these and other measures are reducing the costs for seniors and people with disabilities. So I want to thank all of you for being here today, for your partnership and your commitment to improving the mental health and behavioral health of Asian Americans. Look forward to partnering with you. Thank you.
Thank you, Julia. We have to represent Harris County Public Health. We have Ms. Jennifer Kiger, who will bring remarks on behalf of Director Barbie Robinson.
All right. Good morning, everyone. I'm so happy to be here, and thank you to Dr. Gore and to the Asian American Health Coalition and the Hope Clinic for coordinating this wonderful summit. We've been a proud sponsor for the last decade or more, and we will continue to be that. And also, we worked very closely with them during the recent COVID-19 pandemic, getting testing and vaccination to the communities. So thank you for everything you do. We are really looking forward to the program today and tomorrow that focuses on health, including mental health among the AAPI communities within Harris County and beyond. At Harris County Public Health, we strive to protect health, prevent disease and injury, and promote health and well-being for everyone in Harris County by advancing health equity, building partnerships, and establishing culturally responsive systems. And a key component of that is our partners in the community that is represented here today. Therefore, our focus at Harris County Public Health is to be a health strategist for the county and provide information and data to create new or enhance existing strategies and programs. When looking at the Asian American Pacific Islander community and the data, there is so much diversity within this one category of race, and different data sets categorize these populations differently. Sometimes Asian American is separate from Pacific Islander, and oftentimes the category is omitted completely due to the small sample size. This often limits our understanding of the data and ultimately limits our understanding of the health of the AAPI community within Harris County. As of the 2020 census, there are about 350,000 Asian Americans within Harris County, which contributes to 7.4% of our Harris County population. And when looking at Native Hawaiian and other Pacific Islander community, there's about 4,000, which is about 0.1% of the community. So we look and wonder if there's ways to get better representation of this community into our Harris County population and the data. The AAPI community includes diverse cultural backgrounds. So in the 6 largest subgroups of the AAPI community in Harris County, that includes Vietnamese, Asian Indian, Chinese, Filipino, Pakistani, and Korean, which is just such a huge, diverse community in and of itself. As we all know, understanding the barriers within the AAPI community allows for a more inclusive approach, recognizing diversity within this community. Intervention programs can be established or more impactful by addressing common challenges shared by various AAPI community subgroups. We at Harris County Public Health have a lot of data for the AAPI community and can share it with the group. And we've compiled information such as having high rates of gestational diabetes during pregnancy, low birth rates, and as mentioned before, low utilization of mental health services. I would love to get into all that, but I know we don't have that much time. So please see me after, and I'm sure these topics will be covered in the next day and a half. But if you do want more information, or if you need anything from us, we are able to provide you information to help guide your new or existing programs or initiatives. We want to be a partner, and we look forward to the rest of this 2-day summit, and we know you'll enjoy it. So thank you for being here, and thank you for letting us be a part of it.
And on behalf of the City of Houston Health Department, we have Dr. Deborah Banerjee to bring remarks.
Good afternoon, colleagues, friends, and special guests. On behalf of the City of Houston Health Department, extend a warm and heartfelt welcome to every single one of you for this Asian American Health Coalition Conference. We actually have a long history with Asian American Health Coalition and Dr. Gore herself, who was actually with the Houston Health Department for a few years. And she organized one of the first, well, for me, it was one of the first ones that I attended, conference on Asian American health. So we're very grateful that, we continue our collaboration with the Asian American Health Coalition as well as the Hope Clinic. We know that Houston is built on strength, resilience, and the spirit of immigrant communities. And Asian American community is a shining example of that. My colleague just spoke about the diversity within the Asian American community, different languages, different cultures, different food, this tremendous diversity. So there are challenges that we face in terms of data on the Asian American group. Language barriers, cultural differences, and other socioeconomic disparities cause many obstacles to receiving the care that the Asian American community needs. And this is precisely why the advocacy work of Asian American Health Coalition, as well as the Hope Clinic, is so critical. So I just want to say City of Houston stands firmly behind your mission, and we recognize the importance of supporting and investing in our immigrant and refugee communities and other underserved groups. And we believe that healthcare is a fundamental right and not a privilege. We know that Texas has the highest rate of uninsured in the country. And thank you to the administration for addressing many of those issues through their new initiatives. So we want to work alongside you to address the health disparities that exist and to ensure equity in access to quality care. This meeting serves as a powerful platform for collaboration, education, and empowerment. As we come together today, let us use this opportunity to share best practices and learn from each other and strengthen the network of support that serves our Asian American communities. Thank you once again for being here, and thank you, Dr. Gore, and for inviting us. And I look forward to the next 2 days and look forward to witnessing the continued growth and success of the Asian American Health Coalition, as well as the Hope Clinic. Thank you.
Thank you so much. One comment I want to make is, you know, when we were taking all the registrations, we were really afraid because that we would surpass the capacity of the room. You can see we have some empty chairs. So if you have some friends that still want to come today or tomorrow, I would say invite them to come because I think we have plenty of room now. I think a lot of people switched off of in-person to online. And so that's one of the things that happened. So please encourage your friends to come if they still want to come. Before I introduce our keynote speaker, I'd like to take a few minutes to acknowledge our very generous sponsors without whom we couldn't have had this conference. First, I wanted to, yeah, good, got my slides up. Okay, at the gold level, we have AARP, and they are our premier sponsors. I'd like to ask Tina Tran, who's the state director for AARP, to just make a few remarks on behalf of her organization.
Thanks so much, Dr. Gore. And if you, I'm so happy to be with you all today, and I'll be with you tomorrow. So I'm just going to plug the panel that I'm moderating tomorrow morning at 9:45. It's the one on older adults. It promises to be a really good one. Dr. Gore is also a volunteer with AARP, excellent volunteer leader with AARP. And like they say, if you want something done and you want it done right, ask someone who's busy. And she is always busy. And also I want to recognize another one of our volunteer leaders, Eddie, who will be with us over the next 2 days as well. If you haven't already, please stop by the AARP Texas table out there and speak to one of our associate directors, Chandra Weigel, another wonderful volunteer, Jackie. We have some wonderful caregiving resources out there for you. I think all of these issues really marry together around caregiving, mental health. And so I'm really looking forward to being able to make some intentional connections with all of the wonderful expertise and experience represented in the room today. So thank you so much for giving me these few minutes to speak. Thank you, Dr. Gore.
Okay, also at the gold level, we have MD Anderson. If you're with MD Anderson, you want to stand? Okay, I know we have a booth out there for them. And the Houston Asian American Archives at the Chow Center for Asian Studies, we have Indre Rapalavachuti. Did I say it right? She also asked me just to tell you, they are collecting oral interviews from Asian Americans in our community. And so if you still would like to be in that high collection, please see her. She would like to talk to you. The Rupani Foundation and Ibn Sina, we have representatives from those groups. Thank you for your support. At the silver level, we have St. Luke's Health. I know Scott Packard was here. Okay, or other people with St. Luke's. Thank you. The Hogg Foundation for Mental Health. WellPoint, Houston Health Department with Dr. Banerjee. Harris County, at the bronze level, we have Harris County Public Health, and Ms. Kiger was part of that group. Memorial Hermann Southwest, do we have representatives? Thank you very much. United Healthcare, do we have representatives from them? Okay, Dr. Jeffrey Lee at the patron level and Miss Emily Lee, not here yet. Harris County Public Library, I know we have a booth for them. Texas Women's University helped us with a lot of the poster sessions. And community partners, we have Chinese Community Center, Harris Health, and the Indian American Cancer Network. So let's give a big round of applause for all of our sponsors. Now I have the pleasure and privilege of introducing our distinguished keynote speaker, Dr. Asim Shah. Dr. Shah is probably the leading mental health professional in our area, and we are honored that he could share his time with us today. His full bio is available to you, as the other speakers' bios are in your, if you go to the Summit website, there is a link to the speakers' bios. There are so many speakers, we just couldn't publish them all. But if you go to the Summit website, there is a link to all of the speakers' bios. Dr. Shah is the Executive Vice Chair and Professor in the Menninger Department of Psychiatry and Behavioral Sciences and the Department of Community and Family Medicine at Baylor College of Medicine. He's also Chief of Psychiatry for Ben Taub Hospital, Harris Health System, and the Director of Community Behavioral Health Program for Harris Health System. His service is the largest outpatient mental health provider in Harris County with over 100,000 visits a year. Dr. Shah has done numerous media presentations to national and international radio, TV, newspapers on topics like ketamine and depression, election stress, which we're about to experience in 2024, 2024, mass shootings, stress management, work-related stress, ADHD, road rage, seasonal affective disorder, and phobias. He's received 2 Fulbright and Jaworski Awards, one for teaching and evaluation in 2012, and second for educational leadership in 2014. His current research is in the field of treatment-resistant ketamine, and he was appointed as Board Director for Mental Health America in 2017. So I'll just go ahead and let Dr. Shah take the podium now.
Thank you.